So, good evening, ladies and gentlemen. How you doing? Hope you've had a nice weekend so far. Looking forward to a new week. Tomorrow is Monday. My name is Dr. Akano, President and founder of the Timothy Akano Foundation. Today, I am going to be talking about herpes. I'm going to be talking about herpes. I assume many of you may not know about herpes, but it is a very important infection that everybody should know about. So let's start. What is herpes? Herpes is usually a sexually transmitted infection caused by a virus known as herpes simplex virus, HSV in short. Herpes simplex virus, HSV in short. This virus have two common types, HSV type 1 and HSV type 2. HSV type 1 and HSV type 2. HSV type 1 is the more commoner cause of the problem, especially worldwide, than type 1. But lately, type 1 has been implicated in this infection, especially in the developed world. For whatever reason, I don't want to go into that. So this is what herpes is. It's usually a sexually transmitted infection caused by a virus known as herpes simplex virus. Why is the topic important? It is important because of the complications it causes, which includes, death of your baby, blindness, problem with your memory, meningitis, increased risk of developing HIV, and all that. I will come to it later. So that's why it is important. So how common is this infection? This infection is very, very common. In 2015, over 800 million people worldwide suffered it. So 12 to 15% of people all over the world suffer from this infection. So you can imagine how significant it is. It affects white, black, Asian, Japanese, everybody. It affects men and women. It affects adults and babies. It is commoner in women, unfortunately, and is commoner in people of the age grade of 14 to 49. That doesn't mean it doesn't affect people older or younger than that, obviously, but it's commoner in 14 to 19. So this is a little bit of epidemiology, a little bit of statistics about this infection. So you want to ask, I'm sure you are anxious to know, how is it transmitted? How can you catch this infection? I said it is a sexually transmitted disease, but that doesn't mean it's only through sex. So I'm going to explain the means that somebody can catch it. Sexually, oral sex, anal sex, and vaginal sex. So any of these means of sexual activity can lead to the transmission. It can also be transmitted to a baby through two means. We call one vertical, like something standing straight, and horizontal, something like that. Vertical and horizontal transmission means. So what is vertical transmission? Vertical means a mother transmitting it to the baby during delivery, which is vaginal delivery. If a woman is infected and delivers a baby through vaginal delivery, the baby can catch it. That is what we call vertical transmission. We can also, the baby, a child can also get it through horizontal transmission. Horizontal transmission is like maybe if the woman has a herpes sore around her breast, nipple, and the baby sucks the nipple, that baby can catch herpes. Or if somebody, including the mother, has a sore around their lip or mouth, which is caused by herpes, and that baby is kissed with that lip or that mouth, that baby can catch it. That is what we refer to as horizontal transmission. Vertical is from mother to baby during vaginal delivery, while horizontal is after the baby has been born, either through kissing by somebody who has the sore, or baby sucking breast of with a sore caused by herpes. So these are the means of transmitting this disease. So what are the symptoms of this disease? I'm sure you want to know that as well. Generally, this disease, herpes, is transmitted by direct genital contact with the skin surface or secretions of someone who is infected, usually. That's generally. So what are the symptoms? We are going to lump the symptoms or divide it into two, basically for now, man and woman. The symptoms usually develop between 4 days and 4 weeks after you've had those contacts. You may never have symptoms. It may be asymptomatic, so the person may never have symptoms. But just be aware that the fact that you did not have symptoms does not mean you cannot spread it to the person, to the next person. So you may not have symptoms, or you may have mild symptoms. The commonest symptom would be blister, which may eventually turn into a sore, painful sore. I'm going to show you. I have some pictures of sore, and then the sore can be anywhere between, if you're having oral sex, the lip, the mouth. If you're having anal sex, you might have it in the anus. You might have it in the internal inner side of your thigh. You may have it in your, if you're a woman, in your clitoris, in your vulva, any part of your vagina. Have it in your buttocks. If you're a man, the head of your penis called glans penis, the shaft, any part of your genital area, anus, inner thigh, you can have sore. So sore is the commonest symptom, but that's not the only symptom. So I just show you. I don't know whether you can see that clearly. That's one the sore of herpes. I will show you where this. This is on the vagina. These are sores of herpes. I have more. So these ones are on the lip. I don't know whether you can see the ones on the lips. And then, obviously, this should be clearer. This is on the lips. That's herpes. That's herpes. So these are some of the sores of herpes. So that's the commonest symptom. You may also develop flu-like symptoms. Flu-like symptoms means symptoms like, say if you have flu, malaria, things like aching all over, lethargy, weakness, high temperature. Or you may develop glands around your neck, or your lymph nodes just get inflamed. So these are some of the symptoms you may have from herpes, sore, and these flu-like symptoms. And then obviously, if you do have complications, which I'm going to discuss later briefly, you may have some other symptoms. So Then let's talk about, this is briefly on the symptoms. When we come back to complications, I will flesh it out. So the next thing we're going to talk about is prevention. How do you prevent this disease? I think it's obvious. Number one, if the person has sore, you have to abstain from having sex. Abstinence when the person has those sores. Total abstinence until those sores heal up. Number two, condoms. But obviously, you can see that the condom, let's say the male condom will only cover the penis. It won't cover the thigh. It won't cover the buttocks. It won't cover your pubic area. So condom can give you some protection. The female condom, this is one condition, that the female condom gives more protection than the male condom because it covers more of the vaginal area. So female condom also gives preventive advantage, over the male condom. So using of condom is necessary. There are also something which I've mentioned previously called oral dam, which is like a sheet that you can use to cover the vagina if you do have oral sex. If you want to give a woman a head or something, use that dam to cover it. So that's one of the ways to prevent it. And also, obviously, if somebody that is obviously not infected and you have sex with just that person. And then also, also, like if a woman is pregnant and she has had the infection before, it is always advisable, especially during the last 4 weeks of pregnancy, for them to have a bit of preventive treatment to stop the sore. And also, obviously, if you have sore on your lip, you shouldn't kiss the child. And if there's that herpes sore on your breast, you shouldn't breastfeed the baby directly. These are the ways you can prevent it. There's no, other way that is advisable. And so this is the basic way of preventing it. So the next thing we're going to talk about is how do you diagnose it? So it is diagnosable through, obviously, the physical symptoms. If a patient comes to you with those kind of sores and, maybe those other symptoms like temperature, aching and everything, then that will give you the way that that's possibly herpes. So when herpes affects the genital area, we call it genital herpes. If it affects the oral area, we call it oral herpes. If it affects the anal area, it's called anal herpes. We have other types of herpes, which I'm going to mention. So I want to be quick and also make sure that I'm very simple. I want to make things very simple and easily comprehensible. So how do you diagnose? With the symptoms, another way is what we call viral culture or viral PCR. So you can take a swab from the sore or blister, and just take a swab from the liquid and take it to the lab for what we call PCR, polymerase chain reaction or culture. Some people also do take blood for antibody tests, but it has been proven that the antibody test can actually sometimes only tell you about the previous infection and may not tell you about the current infection. So we tend to go more with the viral culture or the PCR. These are the ways of diagnosing this infection with certainty. It is not a very difficult means of diagnosis. Then we also want to talk about cure. How do you cure this infection when you've caught it or when you have diagnosed it? So at least you know the symptoms now, you know how to prevent it, you know how common it is, you know what it is, you know what to do to stop yourself from having it, but you want to talk about how do you cure it. The bad news is that this infection has got no cure. As once you've caught it, it's for life. The virus will go and hide maybe in your spinal cord or in nerves and stay there. It may stay there forever. But what happens is that the symptoms you have would usually resolve within 4 weeks, 2 weeks, 3 weeks, or even 1 week. It may just go. But the problem then is that it could keep recurring. You may keep recurring, which we refer to as recurrence. I will talk about that recurrence a little bit. So that's a problem, but there is no cure. But if you do have the symptoms, you may take antiviral medication. I didn't say antibiotics. Antiviral, against virus. So antivirals. Some of those are like, I'm not saying you should go and buy them, like acyclovir, valcyclovir, penciclovir, vanciclovir. These are some of these antiviral you can use for this. So since the infection does not have a cure, why take this antiviral? You take this antiviral to reduce the length of the suffering of when you have the pain, when you have the sores and everything. So these viruses can help reduce the pain, reduce the duration of the outbreak, can reduce all that and, help the infection clear quicker when you have that outbreak. So that's why you're taking this antiviral. It is not to cure it. It is to reduce the suffering, reduce the duration, reduce the frequency of the outbreaks. There are even some people that take it every day for 1 year, these medications to stop the outbreaks. I've had, patients that, they do have outbreaks from time to time, and they come for the antiviral and they take it to stop the pain and so these antivirals may come as tablets, capsules, injections, gels, creams in different forms, and they are all effective. But just be aware that they will not cure the problem. The problem could keep coming back and back. Okay, so we talked about that. So let's talk about the complication. First and foremost, let's talk about the very important, they're all important, but I want to talk about neonatal herpes, which is the herpes in the neonate. What is a neonate? A neonate is a baby who is between 0 to 4 weeks of age. That's what neonate means in medicine. When you hear neonate, that means a baby who is between 0 and 1 month. So the younger the child at the time they caught the infection, the worse for that child. This infection could be very, very serious. In fact, 1/3 of all children that caught it die. 1/3 die. So you can imagine an infection that kills 30% to 40% of every child that has got it, even if they are treated. So it is important. So it's called neonatal herpes. And I've explained how the baby can catch it through vertical transmission when the mother had the sore in their vaginal area and had the baby, and the baby caught it during delivery, or after the baby has been born and the baby suckled on a breast with herpes sore, or somebody with herpes sore on their lip kissed that baby. So the baby will catch this herpetic neonatal herpes, which could be very, 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 very serious. So when the baby has this herpes, some of the symptoms the baby may display are sores in the mouth, the skin, the eyes. The baby may stop feeding, very lethargic, will stop thriving, and will start running temperature. So this is very serious. The good news is that it's treatable. It can be treated with intravenous antivirals. These antivirals I mentioned as acyclovir. Intravenous are obviously preparations that are administered through the vein. And they may have to be on it for weeks before they are discharged. But even at that, when it's cured, a lot of them still die. So it's better if we can prevent having this infection by being careful with sex or whatever we do. So you want to ask, can this neonatal herpes be prevented? I've explained to you. And then there's something else we do. If the woman had a new herpes, maybe 4 weeks to the time she's to deliver, the pregnant woman, then it's advisable to treat that woman with this antiviral, to prevent the woman having this sore during delivery. And then if the woman had the infection while about to deliver, a lot of sores, it is always advisable to do a CS at that point in time. CS, I mean cesarean section. Let me make it clear. Women that have herpes could deliver through the vagina and the baby is fine. But you may be unlucky and the child may develop neonatal herpes, which is very, very serious. So, so if a woman has had herpes before, in some centers, few weeks, maybe 4 weeks, when they're about 36 weeks, they are giving antiviral treatment, tablets or whatever form to prevent them to having sores. And if they have a lot of sores, you may go for CS. So this is some of the ways of preventing the child from developing this very serious neonatal herpes. And just be aware that it's treatable with IV antiviral, but even with that, 1/3 still die. So apart from neonatal herpes, there are other complications a sufferer of this disease can have, starting from another eye issue, which we call hepatic keratitis, which is a problem of the eye, which if it's not treated, could impair your vision and could even lead to blindness. So you can see there are a lot of chlamydia causes problem with blindness, gonorrhea causes problem, can lead to blindness, and then herpes can also lead to blindness. And then if you have had herpes and you have the sore, your risk of developing HIV or AIDS, if you slept with somebody with HIV, is a lot higher because of that sore. So the infection goes through the sore. And then some people develop, what we call hepatic whitlow. Whitlow, the infection you have in your hands. So you can have the infection in your hands, your thumb, your fingers, the infection can go there. Or the infection can even go into your spinal cord and go into your brain and cause you what we call hepatic encephalitis, which can be very, very serious. Even though it's rare, but it can be very, very serious. And then there are some people, there is some evidence that this infection can cause dementia in certain people or accelerate your development of dementia, the type we call Alzheimer's dementia. There's another problem we call Bell's palsy, where the virus, it's said that the virus goes into your nerve and in your face droops. And then if you're drinking, water is coming, it's not stroke, but your face is drooping, you can't speak well, your mouth is one side, and your face, it's called Bell's palsy. There's an evidence that this infection causes it. And that's why when people have Bell's palsy, we give them antivirals as well as oral steroids and all that. So, when people like homosexuals, they can also have what we call hepatic proctitis, which is a kind of problem around your anal and genital and rectal areas. Then there are also other symptoms, especially women, they can have apart from the sore and all those flu-like symptoms. You can have vaginal discharge again. You can have painful sex. Again, even the man can have discharge from the penis. You can also, have other symptoms apart from the sore and the flu-like symptoms that I've explained. So, even though this disease doesn't seem to be well known, but a disease that can lead to the death of your child, a disease that can cause blindness, encephalitis, cause aseptic meningitis, cause whitlow of your hands, cause spinal cord issues, shouldn't be treated with levity. It is something that we should be well aware of, obviously. So anytime you have unusual sores like the ones I showed you that are usually painful, I'm not saying that it's only herpes that cause sores in or blisters in your penis or your vagina or your anus. There are so many of them, including syphilis, even though usually syphilis sores are painless. We'll talk about that some other time, and there are other causes, but I just showed you the pictures of the kind of sores you can have from oral herpes or genital herpes or anal herpes. So this is basically, in a nutshell, what herpes is. Okay, I just want to make it keep it short and simple, so that we close on time. So I'm going to look at your questions, or maybe I'll just check whether there's something that I didn't remember to say. Because when you say these things from your head, sometimes you might forget one or two things. Let me see. I've talked about what is it, prevention, how common, symptoms, diagnosis, prevention, treatment, complications. Oh, I haven't talked about recurrence. Yes, the last thing. So recurrence. So like I said, this disease does not have a cure, but the symptoms may resolve with treatment or without treatment. But after some time, the disease comes back again. Some people have more than recurrence more than once. Some people have it often. Some people don't have any recurrence. I think hepatitis, not hepatitis, the HSV 2, that is herpes simplex 2. I think 1 in 80 have only one recurrence. Why the hepatitis 1? Oh, sorry, why am I saying hepatitis? Herpes simplex, number 1 in 50 do have recurrence. So recurrence is that the person develops those sores again, develop all those symptoms, especially the sore, and then you can ask, why do they develop the sore? Like I said, the sores, the virus goes to your nerve and your spinal cord and neurons and hide there. So there are certain things that trigger the recurrence. There are certain issues that would say, oh, these are the things that make it possible or put you liable to having these recurrences. One of them is stress, smoking, drinking a lot of alcohol, when a woman is on her menses, if you're having an operation around your genital area, if somebody is immunocompromised, like the person has HIV, or the person is maybe taking chemotherapy. These are some of the things that can trigger off, or maybe if you're, this sunbed, high sunlight exposure can also make you to trigger the recurrence. So the good news is that most people, the recurrent episodes are not as severe and are not as painful as long as the first one. You understand? So this is what is called recurrence. So with if you have got this infection, if you're under stress, maybe if you're broke or marital problem, you notice that you start developing sores in your anus or sores in your, but you haven't slept with somebody else. So if you don't know the history, you might think that, oh, if you change the sexual partner, you might think, oh, I got this from this person I slept with last week. But this is something that, even friction from sex or even wearing tight clothes tight clothes around your genital area could make you liable to develop having this recurrence. So, and then people that do have recurrence, are treated with this antiviral. Some of them can take it prophylactically. Prophylactically means as a prevention. And I've seen people who take it for every day for a whole year to prevent this from happening. And after a year, they're asked to stop so that we can see whether the infection would give them some peace, So that's one thing that is important with this infection. You don't need to catch it again. That once you caught it, you just could keep having the symptoms forever. From time to time, you just develop sores everywhere. That sores that are very painful, and then you might think that is the person you just slept with. No, it is the one you had 10 years ago that is still coming. Okay, so I think so the recurrence has got. You can prevent it with antiviral. I said them: antiviral, acyclovir, penciclovir, famciclovir, valciclovir. Don't go and buy them. If you have sores, please go and see a doctor so that they can diagnose this. And then if it is, with this information I've given to you, you should be able to know how to manage your condition. There are some things they call do's and don'ts. I don't know. This I've gone like half an hour. Let me see. There are some things, but anyway, I don't want to go too deep and start confusing us. So what I'll do is to look at the questions asked and see if there are, things that I need to clarify. Kissing, yeah, but no. It's no more kissing. It's when you have the sore that you don't kiss the child. Do you understand? And when we talk about oral sex is not kissing, just kissing. I don't want to be graphic here. Well, obviously, you can go and check what oral sex is. When they, like what they say is washing plates or, giving the man a head, for want of better words. Okay, let me see whether I will see any question and then deal with it and then get ready for tomorrow. Let's see whether there are questions. I haven't seen Folashade here. That's strange. She's my constant, regular favorite student. Or maybe Facebook has dealt with her. Okay. Can this infection lead to infertility, difficulty? Because Pratisha and Joku, it is not an infection that normally causes infertility. Only in our speed, though. I think I was slow enough. Evelyn, energy, I'm off and on. Network, sorry. This everybody is saying that I'll watch again. Does it mean that thank you. Benjamin Cheffis, yeah, thank you. You heard me. Oliver, yeah, recurrence. It's not HSB. HSV. H for hotel, S for sugar, V for Victor. Herpes simplex virus. HSV. Oh, your top fan badge has disappeared. It's been happening to a few people, actually. I don't know why. So, what's your favor? No sex. It's good for you. You better abstain. That's our Piken for you. Does multiple sex partners cause it? Evelyn. Obviously, I mean, the more people you sleep with, the chances of you sleeping with somebody who's got it in it. Tight clothes around your genitals, will not cause the infection, but can trigger off the previous infection you had to come back. It's like chicken pox and varicella. People who have had chicken pox, not varicella, shingles, who have had chicken pox, maybe when they were a child, 22 years, and then when they are 50, 60, they develop shingles, and it's the old infection that went and hit in your nerve system. So it's the same way. Chinedu Ebo, it has nothing to do with toilets. Chinelo, Okelo, yes, vaginal discharge. It is one of the symptoms, but I did not say that every vaginal discharge is caused by herpes. There are lots of reasons why you can have vaginal discharge: bacterial vaginosis, chlamydia, gonorrhea. If you do have, obviously, this one, if you have PID, obviously something causing it, trichomonas vaginalis. Oh, there are so many reasons you can have vaginal discharge. What's the common candida? Thrush. You know, there are many reasons why you, I mean, if you have maybe you forgot tampon in your vagina, anything, foreign body, you know, can cause vaginal discharge. So you can have vaginal discharge for several reasons. You know, it doesn't have to be herpes. Herpes is just one of them, but it's not even, herpes is not even classed among the commonest cause of vaginal discharge. You start talking about candidiasis, bacterial vaginosis, trichomonas vaginalis, Neisseria gonorrhea, chlamydia trachomatis. You know, there are so many things that cause vaginal discharge. Vagina is one of my, when I was in Uniben, one of my professors in gynecology, Professor Rue, he used to say, oh, the vagina is a zoo. and it's actually a zoo. It's called, I don't want to go into that now. So, if anyone the infection is wicked, I agree with you. Absolutely. So, okay. Only can it be caught more than once? You don't need to catch it more than once, because if you catch it once, you have it forever. You know, you have it forever. So, yeah. Yeah, thank you. Sore, when I say sore everywhere, Evelyn, you can have sore, your lip, your tongue, your mouth. You can have, you know, inner thigh, buttocks, clitoris, vulva, vaginal orifice, your anus, you know. So I'm not saying you would naturally have a sore in your leg, on your head, you know. There are some people that have what we call generalized herpes, where the infection has spread everywhere. That causes death too. So who else penned down a question? Cause some of us that came late, please, what's the treatment? That's Juvi, Kingmaker, Oswago. There is no cure for this infection, but if you have the infection, you can use antiviral tablets or cream or capsules to reduce the pain, reduce the duration of the of those symptoms, reduce frequency of having it. You know, some of those antivirals are things like acyclovir, famciclovir, penciclovir, valciclovir, but do not go and buy them unless you've been told that you have herpes. If you do have herpes, then you can get them and use them anytime you have a breakout. Yes? So, you can take them. Evelyn, if a woman is treating it, it's like, you know, because this infection is not something that clears. So there is no need for your sexual partner to treat it. What you need to do is that when you have the sore, you avoid sex all through the period until all the sores dry up. All right? I've explained, Uche, Favor, I've explained what oral sex is. You know, people give women, I mean, talking about heterosexual partners, or they give, or gay or lesbians, they give themselves head, you know, suck the woman, or the woman sucks the man's penis, and they have sore there. So this is oral sex, obviously. Yes, I said they are similar. There are other infectious diseases that cause sore in the genital area. There are many, you know. You know, the commonest one that I'm going to talk about in future would be syphilis. You know, but there are several causes of sores. I don't want to start calling the names. Lymphogranuloma venereum and several. You know, but let's leave it for now. Yeah. Evelyn, does it have a cure? Nope. No cure. Is the sore inside? Inside where? you know. So anything else? How long does herpes infection stay in the body? It can stay there forever, Jonathan. It can stay there forever. Yeah. Yeah. What infections can be confused with herpes? Other causes of sores, like I said, like syphilis, lymphogranuloma, venereum. If I told you the prevention includes having sex with somebody that has been tested and is negative of this infection, abstinence, especially when the person has sores, using of condoms. That doesn't give you a lot of protection, but at least it's better than nothing, especially female condom. These are the only ways you can prevent them if you have not had them before. But if you have had it before, you can use antiviral to stop breakdown. But I don't advise you to go and start taking antiviral to prevent you from having the infection. No, don't take antiviral to prevent the infection. But the prevention is based on your habits, sexual habits. Who are you sleeping with? What precaution you're taking, and then this is, that's the way. I mean, if you're the one that does have oral sex, then there's something that is called oral dam, like a sheet that can be put around the vagina to prevent you from having the sore. I mean, obviously, if you see where there's sore, you avoid them putting your tongue there. It is what it is. Hanatu, you said you had battling cyst. So the surgery you had is what we call marsupialization. So you had a cyst around your vulva, and then you had marsupialization to open it and release the sea. So if you had a sore at the place, it may just be a complication of the surgery, unless you had herpes before. You had herpes before, and then the operation you had made the sore to come out again. Because operation around the genitals is one of the triggers to recurrence or having an outbreak. So, in the adult, it cannot be transmitted without sex. But obviously in your baby, it's not transmitted through sex. But in the adult, no, it's a sexually transmitted disease. Well, I'm talking about not just vaginal sex, penetrative sex, can be oral, anal. Can it cause itching in the pubic area? I told you, absolutely yes. I forgot. It can it can cause itching, especially the sore can itch and be burning, but can one apply neoprosel? I think that's a steroid lotion. I don't understand the relevance. Do we have antiviral? It's not antiretroviral. Antiretroviral are the ones you use for like HIV and hepatitis. I mean antiviral. Yes, they do have it in Nigeria. Of course. Nigeria is not that backward. Diamond wood, it is serious. Serious gore. It is serious. There are a lot of sexual infections that are so serious that people do have complications, and they don't know that it's because of it. They will have a baby and the baby dies, and they'll be saying it's mommy water or abiku or somebody from their family has put jars killing their baby. But it's what they got from sex. Unfortunately, it is what it is. Can you make the vagina to smell often? I mean, if you do have discharges, you can smell, but it's not one of the causes of bad smell that like what you have in bacterial vaginosis, trichomonas vaginalis, where your vagina smells like fish and things like that. No. Apart from sores, I said sores are the commonest symptoms, but you can have flu-like symptoms, like high fever, high temperature, which is fever, aching joints, feeling lethargic, your glands are up, what we call lymphadenopathy or lymphadenitis. You can also, maybe a woman, you can have a vaginal discharge, you can have painful sex, Evelyn, yes, it doesn't have a cure. When you say something doesn't have a cure, it's like HIV doesn't have a cure. Do you understand? So the same way it doesn't have a cure, So but you can eradicate the symptoms, and they may keep coming back. If you're lucky, it won't come back ever. Some people it comes back often, every year, every 6 months. Some people it doesn't. So that is it. I can't believe there's something like this. Victoria Mitch, I said yes. If you do have what we call generalized herpes, it can lead to death, and obviously can kill a baby that has neonatal herpes. It can lead to blindness. It can lead to encephalitis. Encephalitis can kill. And then it is what it is. Unity, thank you. Noella. I heard cream is not good for it. That's not correct. I don't know who gives people all those fake information. You can use cream for vaginal infection. It depends on what infection you're treating. It depends on what infection you're treating. If you have herpes sore, you can use the antiviral cream. If you have candidiasis or thrush, you can use the cream. It depends on how bad it is. You don't always have to use the vaginal tablet for thrush. Do you understand? And even, there are a lot of conditions that you can just use cream, and then around the vagina, if you have jock rash around the vaginal area, you can use cream and it would clear. If you have eczema around the area, you can use, what we call moisturizers, or you might use steroid creams, and it clears. So anybody that said to you that creams don't work around the vagina or whatever, is just begging the question. Winifred, if you don't actually have the symptom, if you go for, unless they just take your blood for the antibody test, because the swab is only taken from the sores and the blisters, but you can do the antibody test to know whether you have the infection in your body, yes. But if that test is available in Nigeria, I haven't got a clue. It may well be there. How long can it be managed with this antiviral medication? You take the antiviral medication until the sores dry up, and and you get yourself back, and all the symptoms disappear. But if you do have recurrent outbreaks of these sores, then you may be on this antiviral every day for even up to a year. So, he said you can't contact a virgin like me. A virgin can contact it because it's not only through vaginal sex, oral. Virgins do have oral sex. Evelyn, no, I wouldn't say. I mean, diabetes and hypertension that you mentioned, these are not, they're not infections. Diabetes is a disease, lifelong, which does not, at the moment, have a cure, but it's got treatment, and you can live as long as it's practicable if you are controlling your blood sugar levels, as well as you're talking about hypertension. But HIV is HIV is a much, to me, is a much worse disease. Because the issues of HIV are a lot more than the issues of herpes. It's not. I would rather. I mean, I'd rather have herpes, that's me, than have HIV. Let me put it in that context for you to understand. Okay. So everybody's shouting about, can one live normal with herpes? Yes. When you don't have the symptoms, you go your normal business. Yeah. You don't need to be on anything. That's why I said it may be asymptomatic, means no symptoms. So you can have herpes without symptom. Is it hereditary? It doesn't run in your gene, but obviously can pass it to your baby if you have the physical infection, but it's not something genetic that you say, oh, I'll inherit it from my daughter or my father. No. Can somebody have it and live a normal life? Absolutely. Like marry, have children? Absolutely. Absolutely. Why not? Okay. I had a lot of questions today. Benjamin Chef said, how can we know that the person is negative? It's through the, if you don't have the source, you go and do antibody tests, and if antibody tests, says that the antibodies are not there, then that is there any vaccine for it? No vaccine. UK Omelo, is it common in the society? It is very common. I said in 2015, up to 12 to 13% of everybody in the world caught it. They caught it, had it. So you can imagine. Over 850 million people. Yes, Evelyn, is there any hope of having children for a young girl who has not married? Yes, of course. Absolutely yes. Can a little child of 10 years or below, I told you about a 1 day old can catch it through their mom. So, 1 day. So, I'm not going to, any question that I've asked, answered before, I won't answer again. I will save it. Tochi asked, antiviral to reduce recurrence. I said, yes, that's what I said. Absolutely yes. Where's my water? All the people that said that are saying that they're just joining, I'm going to save the video and then you can watch it at your own time. And then if you have any question, you can ask and I will answer you, okay? Yes. Sickness there. I'm going to talk about syphilis. I'm going to talk about HIV. I'm going to talk about hepatitis A, B, C, at least. And then all these sexual infections, trichomonas, vaginalis. Maybe talk about bacterial vaginosis. It's not a sexual infection, but it's one of the commonest causes of vaginal discharge. Candidiasis, vaginal thrush. Yeah. So I think I've answered all the questions. Anybody who I haven't answered their question should lift up their hand or their finger, then I can see. What did he say causes it? Yanrasa. Oh my God. All right. I think, Paul, I think I've answered all your questions. So I shall be going off the radar shortly. So yeah. If you join, what's your name, Winifred, you're going to learn a lot. You know, swear to God. Oh my God, it's better for us to be very careful who we sleep with and how we sleep with people, you know, because the disease is out there, multi-numerous, if I would use such a word. Session. Thank you for making it quite interactive. And so when we come your way again, maybe in a fortnight, we'll talk about another sexual transmitted infection. Thank you. Good night, guys.